This conference will now be recorded.
All right, folks. So I appreciate you coming tonight to this special GoToMeeting class. So I'm sorry that we missed out on Monday as far as the lecture lab was concerned. So tonight I'm not going to lecture, but I am going to review the muscles that you need to know for this past week, and I'm going to show you some images and share images on our my Warren for our class. This is what important though, what I want you to do as far as helping you to understand muscle contraction. Now, you'll have to do a summary of all three of the videos for skeletal muscle contraction: the neuromuscular junction, the excitation contraction coupling, and cross bridge cycle. I was able to post, so in my video that I did for the lecture last week, it has all of these videos in it, but I wasn't able to post all three of these videos separately on my website, my YouTube channel. So the third one, the cross bridge cycle, did not come up on the channel. So you'll have to search that out on YouTube and go over that. A summary, you can put it on. My recommendation is to put it on the closed caption. And when it comes to the time where they're discussing what takes place at the neuromuscular junction, you write down all the steps from the action potential traveling down the axon of the motor neuron to the end when the acetylcholinesterase will help to break down the neurotransmitter acetylcholine into acetic acid and choline. Okay, so like that's what you have to follow. So for all three of those videos, I want you to do that. The only grade that's going to be given on this, it's either going to be you do it or you don't do it, 100% or 0. So I know that you'll all do it and get 100% on that. And actually, I'm going to apply this to a quiz. So I'm going to apply this to a quiz. All right, so this will count towards a grade, and because it's a lot of work, but it's a work also that's going to help you to understand and know what's taking place with skeletal muscle contraction. So do we have any questions? I'm going to stop sharing for a moment here. And I'm going to, no, I'm not going to share it. I'm going to keep everybody hid. I'll keep on sharing, but you can speak and ask me a question if you would like to. Does anybody have any questions regarding this?
I'm sorry, I was dropping off my son. Are you gonna post that like on the online so I can see it? I totally missed everything.
Yeah, it'll be a coursework. No, I didn't. I'm gonna make sure that it's in coursework for you all. Okay.
Okay.
And that'll
Perfect.
So this way you can have this done, and we'll make it do for a week. Okay.
Okay. Thank you so much.
Yeah, no problem. Sure. So it'll be due from today.
So sorry, are we submitting it via email?
No, what I'll have you do is I'll have you upload it. Yeah, so I'll have you upload it. And again, this is really, honestly, folks, it's not really for me. This is for you. This is to help you. And I would tell you, in order for you to really own it and know it and memorize it, you should probably do this multiple times, to be honest, when you're studying for this test. Okay. But just do it one time for me, and then you could rewrite it as often as you'd like in order to try and get it down and memorize it. It's going to help you with the anatomy as well as the physiology of what takes place as far as skeletal muscle contraction is concerned. Okay. And then next week I will finish up. Next Wednesday I'll finish lecturing on chapter 9. I believe it's the muscular system. Okay. Understood? Any questions with that? Okay, good. All right. So I'm going to remove this document. Yeah, so Jen, so it's going to be on, thank you. So test number 3 will be on your, let's see, it'll be on skeletal system and the articulations and the joints. So skeletal system articulation, test number 3. Let me write that on here also. And that will be, I think that's going to be in 2 weeks or so. I have to look it up. I'm sorry. I don't know, but it's pretty soon. So
it's on
skeletal
23rd.
system.
It's on 23rd of November.
Okay, thank you.
You're welcome.
Okay. I don't remember the numbers. I'm sorry. I don't remember chapter numbers. It's skeletal system and articulations. Okay.
Yeah. It's chapter 6 and articulation is chapter 8.
Thank you.
You're welcome.
Very good. Thank you. Thank you. I appreciate that help there with that. Good. Very good.
Professor,
Yes.
I think it's chapter 7.
Chapter
So it's
7 is
not-
the articulations.
Yeah.
Okay. All right. If I'll have to check this later. I'm sorry, but I can tell you this though, that the material.
I'm sorry, it's not the articulation, it's the skeletal system. It's chapter 7 and 8.
It's 7 and 8. Okay.
Yeah. Sorry.
No problem. Okay. All right, folks. So skeletal system articulations, that's going to be the next test. That'll be coming up on the 23rd. Okay. So that'll be the week of our of Thanksgiving. Okay. So I will check and make sure if we're having lecture that week, but definitely both groups will be in lab on the 23rd. Okay. But I'm going to see, because we missed this past week, if we can have both groups in on Monday, next Monday, this coming up Monday. And I'll split you up into 2 rooms, just like we did when we were doing the testing. Okay. So I will let you know regarding that. I'm going to ask if we can do that. All right. All right, folks. So you'll have this information. I'll post this in coursework. I'll also make sure that you know this as far as on the announcements there, as far as test number 3 and the chapters and the date. Okay. Very good. So let's go here. Let's go to our first image tonight that I'd like to review. Let's look at this one first. And again, I will post these images for you folks. So online on our documents and resources, so that this way you'll have an understanding and be able to have images as well as what we're doing in the lab and such, right? Because again, we were going to be doing videos of all of these different models that we have in the lab. You'll see here, folks, that we have the frontalis muscle. It's also called the occipitofrontalis muscle. You'll see right here, because it's the occipital muscle, the frontalis muscle, right, covering those both bones, the frontal bone and the occipital bone, and then it has what's called an epicranial aponeurosis, which is a connective tissue connection between the 2 muscles there. So I'll show that in lab. But you'll see here also that we have these orbicularis muscles, orbicularis oculi, and orbicularis oris, okay, going around the openings of the oral cavity, the mouth, and of the eye. Okay. Then you'll see here that you're just seeing a little piece of the temporalis muscle. You'll see it on the lateral image there. Okay. But what I'm doing is I'm using, as I'm sharing my screen with you here, I'm using this image, right, this Word document that I posted for you all in documents and resources regarding the muscles of the head. Okay. So as we're looking at this here, so you can also see that there is you're not really seeing the nasalis very good in this image here. Again, I'll show this to you in lab, but you'll see here that there's a muscle that's adjacent to the border of the lateral aspect of the nose itself, okay? And that would be, you'll see here, the levator labii superioris. And what that muscle does when it contracts, it helps to lift up the lip, okay? So labii, the lips, so it helps to elevate, lift the lips. So for a smile, right? That's what that would be aiding and assisting with as far as action is concerned. And when we think of the skeletal muscle, we always think of the action that's taking place, because when a skeletal muscle contracts, what action occurs? What happens as far as when that muscle contracts? So now you're going to also see here that there's a muscle, as we're looking at the list here, depressor anguli oris, going to the angle of the mouth itself. So right at the angle here, that is the depressor anguli oris. Depressor labii inferioris would be the lower lip, so the upper lip, levator labii superioris. Depressor labii inferioris, so it would aid in pulling the lip in the inferior position, downward, right? Here we have the mentalis muscle right here, cut here. When that muscle contracts, you can see the dimple here in the chin, right? So the cleft chin would be that contracture of the mentalis muscle, okay? Let's see what else we're looking at here. So we can see sternohyoid, you need to see here. So it's going to the sternum as well as to the hyoid bone. So here's the hyoid bone, that floating bone, okay? Not a part of the cervical spine, but the hyoid bone is anterior to the cervical spine, okay? Let's see here, as far as omohyoid, I'd have to really, you'll see a piece right here and right here, omohyoid. The digastric muscle, this right here, that you see right here, that also is a two-bellied muscle that difficult to show you here, so I'll show you that in lab for sure. But omohyoid is also a two-bellied muscle. This is the sternocleidomastoid muscle right here, okay? And the scalenes, you can see, so if this is the anterior, we have anterior, middle, and posterior scalene. There are three muscles that are deep to, when you see here, the sternocleidomastoid, okay? If you were to remove that, you'll see that the SCM has been removed, and you can view then the scalene muscles deeper, okay? Let's see, as far as, you'll see here also, so we have here, and let's look at the lateral view now. So the lateral view, here we go. Okay, so on this lateral view, let's increase let's see this a little bit. Yeah, so here, you see where it says the gala aponeurotica, right? So we can also call this the epicranial aponeurosis. So it's connecting the connective tissue, frontalis muscle, occipitalis muscle. We can call this the occipitofrontalis muscle, or we can just say then frontalis, occipitalis, epicranial aponeurosis, connective tissue. Here we see the temporalis muscle, and really this is a deeper muscle too. You'll see on your list there where it says the auricularis muscles. I'm going to show you that in the lab. You're not seeing that on this image right here, okay? As far as the zygomatic muscles are concerned, so if we have the zygomatic bone, right, for the cheeks, right, you'll see here that we have zygomatic minor and major, and it's a little bit easier to see in the lab. Again, I'm sorry, but I'm just trying to show you here, but you'll see that minor is always superior to the major. So the minor, major, superior. Minor is always superior. We're going to see that in the teres muscles, teres minor, teres major, as well as the rhomboid muscles, rhomboid minor, rhomboid major. The minor is always superior to the major, okay? Just keep that in mind. You'll see here that we have the Radialis muscle right here. This is the masseter, and you'll see in the lab even that it'll kind of come more to here as far as its origin and such. The masseter is quite a large muscle as far as for the cheek. And then we also have deep to, Radialis would be the buccinator muscle, which you'll see in the lab, and you'll see that if I were to be able to remove the masseter, you would see buccinator and Radialis even more clearly. The platysma muscle, so this is a weird muscle, folks, right? So like if I contract the platysma, see how you kind of look a little weird, you know, but you can feel that flat muscle in the anterior to all the neck muscles, the anterior neck muscles, the platysma. We don't have a model in the lab that actually shows you platysma, but just know that this is anterior to the anterior cervical muscles here. So platysma would be anterior to all this musculature, okay? And you're also seeing here that we have the upper belly of the trapezius here, okay? Splenius capitis is in the lab. I'll show you as far as on the model. It's very easy to see, but you'll have to know that muscle also. And sternocleidomastoid, that's just a piece of it right here that you're viewing, okay? You're seeing here as far as, so the angle of the mouth, so here's that depressor anguli ora, oris. So it's right here to the angle of the mouth. Then we have next would be then the depressor labii inferioris right here. And then here would be levator labiae superioris. And really it's kind of more in through here. This is called levator labii superioris. The other one. I didn't put it on the list here, but it's also it's another muscle adjacent to levator labiae superioris. And it'll come to me. I'm sorry, I don't remember. It'll come to me. All right, folks. So we have here these the muscularity here. Let's minimize this, and then we're going to go to. Let's see. I want to show you. So here we have upper extremity, as far as the arm is concerned, the forearm, and the torso. So this list is what I'm using here, okay, for the next group of images and such. And so I'm
Just
Go ahead.
one quick question on
Sure.
the list that you have for the muscles of the head. You have listed frontalis and occipitalis. Those are the same?
No, okay, so look at this image right here. So in anatomy, they like to use, they'll say occipitofrontalis, or yeah. So let me show you this one here. There's AKAs, also known as, right?
Mm-hmm.
And that just happens a lot here. So look at what it says right here, occipitofrontalis muscle, and they're pointing to this. You're like, well, where's the occiput? Well, here's the deal. Occipitofrontalis muscle is this whole structure. So from occipital, frontal, the epicranial aponeurosis, I just give it to you and say, hey, know the frontalis muscle, know the occipitalis muscle, and know the epicranial aponeurosis. Understood?
Okay. Okay.
So AKA is also known as. Okay. So if you were to say occipitofrontalis muscle, you wouldn't be wrong. Understood? Okay.
Okay.
Very good. Yeah, it's just in anatomy, there are many AKAs, also known as, right? So as you'll see here, so here we're looking at the lateral aspect, and really we're looking at primarily more of the extensors, and you can see a little flexor right here. But let's first look at the proximal muscles of the arm and shoulder, okay? So what you'll see here is that we have the deltoid, right? The deltoid is the lateral aspect of the upper arm, shoulder region, very large muscle, many, like the muscle belly is spread out, we would say. You'll see here as far as this would be, again, posterior, this is anterior. Now, when we're looking at anterior, what we're seeing here is that this is the subscapularis muscle, and this would be then the teres major. So we have teres major right here and right here, teres minor, and then we have supraspinatus and infraspinatus muscle. Because what is right here, if I were to remove this deltoid, you'd see the spine of the scapula right here. Again, remember this is posterior. So this would be the spine of the scapula, all right? So triceps brachii, biceps brachii, you're only seeing a little part of it right here. Here on the anterior, you're seeing more of the biceps brachii. Here you're seeing again triceps brachii. If I were to remove this, you would see then the brachialis muscle, and you'd also see, here's a portion of, here, well, no, you can see coracobrachialis muscle is right here. It's not labeled on this image, but that's coracobrachialis muscle, okay? As we
You said those are all anterior, right? I'm sorry.
On this side, it's anterior. On this side, we're looking at posterior, except for the deltoid. I mean, the deltoid really wraps around the whole shoulder. Understood?
Okay.
Mm-hmm. Okay. Now, when you look at the forearm, I'm going to tell you that the forearm can be very challenging, but you have to think of the forearm as it is a tube. And so even when you're looking at the posterior aspect, you're going to see a part of an anterior muscle, which would be the flexor carpi ulnaris. Now, carpi, we think wrists, right? So if it's going to be a wrist flexor, it would be a flexor carpi. If it's a wrist extensor, right, extending the wrist, it would be an extensor carpi. Okay, do you understand? That's pretty, you have to think along those lines. So where would I expect to see wrist flexors? would be more anterior. Where would I expect to see wrist extensors would be posterior, okay? Does that make sense to you all? I hope it does, because that's just how it is. So an easy, really an easy muscle that you can look to as far as a guide to go from anterior and then to go from posterior would be the Brachioradialis muscle. The Brachioradialis muscle right here. It's right here, and it's right here, okay? Then this way you can go from there, you can see that you'll have the flexor carpi, okay, flexor carpi, and then what is the thumb side? It's the radial side. What would be, so this is number 1, this is number 5, okay? So the thumb side would be number 1, and we have here then, this is the radial side, here would be the ulnar side. So hence, flexor carpi radialis, okay? So if you look on your list here, flexor carpi radialis. Now you'll go here and you'll see that this is palmaris longus, and what you'll find is that you'll see that the tendon, you'll see the tendon that extends to the palm, all right? So that's kind of an indicator when you're looking at that muscle that that is palmaris longus. Then you'll come to right here, okay? So then we have flexor digitorum superficialis is right here. It's not labeled, but it's right here. It's adjacent to, and again, we're not in the lab, but I'm just trying to do the best I can for you here. So we have palmaris longus, then we have flexor digitorum superficialis. There's 2 tendons, and then we have adjacent to that would be flexor carpi ulnaris. It's on the ulnar side on number 5 side. Okay, so we have radialis, thumb side, because that's the radial bone, and then we have ulnaris. There would be the ulnar bone on side of number 5. Okay, so these are all, we're dealing with the flexors, except for this muscle right here, which is also not labeled. This is the Pronator Teres. See that there on the list, Pronator Teres. So recall pronation, pronation, supination, pronation, supination, okay? And brachioradialis also enables pronation in addition to elbow flexion, okay? So now let's go to
Sorry, sir, can you repeat the name, please? Pronation. What did you say the name? Pronation.
So it's on your list, Pronator Teres, okay? Pronator Teres. So you have here brachioradialis. So on the anterior, brachioradialis, Pronator Teres, flexor carpi radialis. You have here palmaris longus. Then you have flexor digitorum superficialis, and then you have flexor carpi ulnaris.
Thank you.
You're welcome, sure. And again, I'm recording this so you can review this and go over this, okay? Then we have for the extensors, okay? The extensors, and you really, so let's start with, we start with also brachioradialis. So when you're on the flexor side, when you're on the anterior side, I start with brachioradialis and I go over, and I go from lateral to medial, okay, anterior. That's the anterior, from lateral to medial. Now I'm going to be going from posterior aspect from lateral to medial. And so what we're doing is that we're looking at the posterior aspect of the model. So I'd have the model in this position, right, on the table. And then you'd see here that we have, now this is pretty interesting. Look at your list for me, please, if you have it there. If not, I'll just talk you through it. We have 4 muscles that are longus brevis, longus brevis. Okay, let me read them to you. These are extensors of first of the wrist, and then we have extensors of pollex, your thumb. Okay, so we have extensor carpi radialis longus, and so you see it right here. Extensor carpi radialis longus, it's adjacent to brachioradialis. So extensor carpi radialis longus, and then here's brevis, extensor carpi radialis brevis, smaller muscle. Then we have over here, we have 2 muscles for the thumb, an extensor carpi, an A comes before E. And I'm saying, well, why do you say that? Well, first it's longus brevis. Then we have abductor pollicis longus, extensor pollicis brevis. Longus brevis, longus brevis. When you see it in the lab, it'll be much easier to determine, but this is an image of, and this is why I'm going to post this image for you all. This is an image of the same exact model that you have in the lab. Understood? So that's why I'm sharing this with you all. Okay. So you'll have there two longus brevis muscles. One group, it's the extensor carpi radialis longus and brevis right here. And then you have abductor pollicis longus, extensor pollicis brevis. You'll have a longus brevis also there. Then you're going to go to extensor digitorum right here, adjacent to those muscles. And then you're going to have here extensor digiti minimi, which will have really just like one tendon adjacent to a muscle and a tendon adjacent to extensor digitorum. And then you have then the extensor carpi ulnaris, okay, which would be adjacent here, right? So here's the ulnar side, extensor carpi ulnaris, and then you're going to have here flexor carpi ulnaris, right? Because the extensor and the flexor are adjacent to each other, and they're ulnaris because they're on the side of the ulna, right? Which would be the medial aspect of, right? Lateral to medial, lateral to medial. Are there any? I know that I have to tell you that with the forearm muscles, those are the ones that are kind of the trickiest part of the skeletal muscles that you have to learn and know. So you have to, you know, like look at the list and go over the models, and this is why I will be pushing for you all to be there on this coming up Monday, if at all possible. I understand with babysitting and different issues that you folks may have. You know, I can't force anybody to come on a week that they aren't normally scheduled, but I'm just saying if you can make it, if you can make arrangements, because you missed out this past Monday due to me being sick, I would like you to be able to be there on campus on Monday. I'd like to have the whole class on Monday, again, splitting you into two different rooms, okay? All right, so let's then, and onconius is kind of, let's see here, so it's kind of hard for me to actually see. Let me show you onconius. Here we go. So on this muscle right here, onconius is adjacent to the olecranon process. So your elbow, what you would point to as your elbow, adjacent to it would be and you're seeing here also brachioradialis, extensor carpi radialis longus, and then here it would be onconius adjacent to the olecranon process. Okay. Let's
Dr.
now
Perr,
yes, go for it, please.
would you be able to post that picture as well also?
Sure, I can do that, yeah.
Thank you, appreciate it.
Sure. There we go. Yep, no problem. And let's go to, we're gonna look at the torso right now, okay? So on the torso, I can't make it bigger. So on the torso, we have here, you'll see that as you're looking at this image, you're going to see that, okay, here we have external features, and here we have more deeper features. Do you understand that, right? So the pectoralis major is covering pec minor in through in here, okay? We have here, this is the aponeurosis of the abdominal, the rectus abdominis. So you're seeing that this connective tissue is covering the musculature here as far as the rectus abdominis. Now, also what you're going to see is that here's external oblique, and you're going to see, and it's easier to see in the lab, you'll see the fibers of the external oblique. Well, if I were to remove this external oblique, you'd see then internal oblique. It's deeper, and you see the fibers going in a different direction. Understood? So external oblique going in, the fibers are going in one direction. Here, internal oblique on the other side, they're going in a different direction. Okay. You'll also see here that we have serratus anterior is really right here, inferior and lateral to pectoralis minor, and pectoralis major covers pectoralis minor right there. Okay. Here we're seeing, as far as looking at this model, so we see here sternocleidomastoid right here, the SCM muscle. We see here the deltoid muscle, biceps brachii. Posterior to this would be triceps brachii. Here's brachioradialis muscle right here. Okay. And then also, what I would like you to see is that there are, in our model in the lab, I can take off this abdominal pelvic plate right here, and when I were to turn it around, you would see the transverse abdominal muscle, because those fibers are going in the horizontal, aka the transverse plane. Okay, and I'll show that to you in lab. Okay, so that's where transverse abdominal muscles would be in that direction, deep to the rectus abdominis. Okay, and also the intercostal muscles you're really not seeing very well, but the intercostal muscles, see here, internal, external, they are between the ribs. Okay, so when you have ribs, when you go to some type of restaurant and you eat ribs, what you're eating are the intercostal muscles, the muscles between the ribs. And I'm sorry to ruin that for you, but it'll stick in your memory now, though. Okay, all right. So anterior torso, and then here we have posterior torso. Okay, good. So this is you know, just looks just like the model that we have in the lab as far as our large model is concerned, our full body model. And so what you're seeing here is that you have Gluteus Maximus right here. You have here latissimus dorsi. You have here trapezius muscle, right? Now look at on this side. So these muscles are deeper than the model portion on the right. So the model on the right, this is more external, and then you see here, as far as the more deeper muscles on the left of this model. Okay, so you see here that splenius capitis is right here. You'll see rhomboid minor and rhomboid major. The minor is superior to the major. Rhomboid minor, rhomboid major. Okay, you'll see here we have supraspinatus muscle, we have infraspinatus, then we have teres minor and teres major. Minor, major, as far as the minor superior to the major musculature is concerned. So you'll see trapezius muscle goes like this and here. So all of this, trapezius muscle. Latissimus dorsi, okay, the lats you would call. Okay? Again, I'll post all of these images for you. And then lastly, this week I wasn't supposed to go over the lower extremity, but I would like to do that for you right now and just show you that, yes, there's quite a bit of muscles to know for this also. And I want to post this for you because this is the exact image of the models that you have in lab, okay, that you'll be tested on. So I wanted to post this image for you all, okay? So you'll see here, as far as, so we have the medial aspect, we have the lateral aspect of the leg. And so it's a little bit more difficult to really see like the anterior, but they're just trying to give that to you. And I think that I can find an anterior image for you also. But with the anterior, you know, I mean, like with both of these images, you'll be able to see pretty much where the muscles are. And like I said, when you're in lab, you'll be taking video, so that'll be helpful. Okay. So you'll see here, Gluteus Maximus, all right. And this is also minimus and medius is really the superior aspect of this model. I'll show that to you in lab, okay? Tensor fascia lata, it's right here. We have the iliotibial band, it's right here. So this is connective tissue. So we have TFL, tensor fascia lata, and again, this is the lateral aspect. The IT band, the iliotibial band, okay? Then we have here, as far as on distal, gastrocnemius. When you think of your calf muscle, you think of the gastrocnemius muscle. Deep to the gastrocnemius, you can just see a portion of it right here, would be the soleus muscle, which is a longer, flatter muscle of the calf. So gastrocnemius is what you palpate when you touch your calf muscle, and deep to that, to the gastrocnemius, and also working together with, in conjunction with a synergistic muscle would be the soleus muscle. Then you'll see here on the lateral aspect, we have fibularis longus and brevis. So there's longus and brevis, okay? The brevis almost looks like that you were taking a portion of an arrow, like the end of an arrow. That's kind of like what brevis looks like, to be honest. When you're in the lab, you'll see, and it does pretty much. You'll be able to see the difference between fibularis longus and longus and brevis. And again, the fibula is the lateral aspect of the lower leg. The tibia, right? So the tibia is the larger bone and medial of the lower leg. And so tibialis anterior is that muscle. When you dorsiflex, when you bring your foot superiorward, you can feel tibialis anterior contract. Now, and aiding in the extension of the foot and the toes, extensor digitorum longus, right here, adjacent to the fibularis muscles. Okay. Now, as we go then to, let's see, the posterior aspect of the thigh, okay? So we're looking at hamstring muscles, So the lateral aspect would be the biceps femoris, and then you'll have semitendinosus and semimembranosus. And semimembranosus would be more medial than tendinosus, and it's deeper. So semimembranosus right here, you can see a portion of it here on the medial aspect of this model, and it's also medial inferiorward, more distal towards the knee, okay, in the popliteal region, okay, or the popliteal region, okay, posterior to the knee, okay. Here, so this is the hamstring muscles. So again, biceps femoris, semitendinosus and semimembranosus. Membranosus is medial and deep to the semitendinosus. Then as we come over here to this model and to finish it out, well, let's look over here for a moment here. And what you're seeing is that the quadriceps muscles, so the quadriceps are the anterior thigh. There's 4 muscles. On this model, unless I remove some pieces here, you're not going to see vastus intermedius. So what you'll see is here, rectus femoris, you'll see vastus medialis, and if I were to remove rectus femoris, you would see vastus intermedius, which is one of the 4 muscles. So we have quadriceps comprised of rectus femoris, vastus lateralis, vastus medialis, and then vastus intermedius, which you're not seeing unless I remove the rectus femoris muscle, okay? So you see here that you have the rectus femoris anterior, the biceps femoris posterior. You'll see on the medial aspect of the thigh, you'll see this muscle right here, which is the gracilis. And then you're also seeing this sartorius muscle. The sartorius muscle comes anteriorly and across from lateral to medial, okay? All right, folks, so it's a matter of looking at multiple images, taking pictures when you're in the lab, holding and touching the models, and saying out loud what a muscle is as you're looking at it and touching it. Very important, folks. You have to do all that you can in order to get these terms into your head. Now, I'm going to tell you also and encourage you all that some of you had some issues with remembering terms when you were in the practical examination. And the reason for that is you didn't go over the terms enough in order to get them stuck in your head and memorize them. And what I mean by that is not that you didn't review it enough, but you didn't review it in different manners. And you should be saying it out loud. So I would create an MP3 sound, file of you speaking these terms, okay? And then listening to these terms over and over and over. And actually, you should take the list of terms and rewrite the list many, many times over, so that this way, when it comes time to take the practical exam and you're having issues, you won't have issues because you will have studied and reviewed these terms many different ways, okay? Even to the point of creating little groups of the terms depending upon if we're at the anterior, so having, you know, the quadriceps, the hamstrings, the lateral leg muscles, the lateral leg muscles here, the medial muscles right in here. Yeah, folks, whatever it's going to take, but you have to, if you didn't feel that you did well enough on the practical exam, come talk to me next time that we're in class, please, in the lab. And I'll just review with you and talk with you a little bit about how I would recommend that you kind of switch things up a bit as far as studying is concerned. Okay. All right, I'm going to stop recording.